Thank everyone, especially my students, for such kind words for me and all the other seniors and the teachers here. Like people said, I've been avoiding this and postponing this for the last few years. But this time I couldn't avoid it. The only way I could avoid it was changing my city and probably moving to a new place and a new ICCM branch. Otherwise, I had to confirm this, and so I did. I accept this with a lot of humility. So, we all know that there are two noble professions in this world. One is teaching, and second is being a doctor. And I think we've been blessed by this opportunity to be able to do both, being a teacher and a doctor. So I think it's really a rare opportunity where we can do it, both of them. And in my journey from being a student to a teacher, I have come across excellent teachers throughout my life. As I already told, that I did my schooling from Vishyavali, which is a small boarding school in my Madapalli. Only around 400 students starting from class 4 to class 12. So we had a lot of teachers, and then we had a lot of interaction with the teachers. We used to stay for nearly 8 months in school and 4 months at home. So that probably they taught us much more than what our parents could teach us with regard to the values in life and how to connect ourselves and everything else. And in school, we never knew what the religion or the caste or the social status or the financial status of the other student was. And we were taught equality and caring for each other, and all those important qualities we were taught in our school by our teachers. And so I always fondly remember Vishyavali for all that it has given me, and all the teachers in Vishyavali who taught me a lot for my basic thing, apart from the academic part, of course. And after that, I moved to Karnool Medical College where I did MBBS. And in MBBS also we had a lot of teachers. Most of the departments were very good at that time, and they had very good teachers. And they taught us basic things like examining a spleen, liver. They should really hold our hand and literally teach us. And that I find it lacking nowadays in most of the medical colleges, because most of people just go to the slides or go to the internet and they read about it, and the clinical this thing is lacking. But we have very good teachers, and they are a real inspiration to me. I would like to, in this circumstance, I would like to name a few of them actually. Though all of you may not know them, but like in medicine and pediatrics, we had very good, excellent teachers in Karnool Medical College, and because of whom I was inspired to go into the medical side rather than gynecology, which was the norm at that time. Well, all women would go into gynecology, but I was, because of the inspiration of these people, I went into medicine. There were Dr. Sudhakar and Dr. Venkatanga Reddy were pediatricians in our department. It was an excellent department we had, and they really, not only in the department and pediatrics, they even, like Dr. Venkatanga Reddy, even took extra time out during a house residency to train us and for the PG examination preparation, all that. So there's nothing he gained from it, but he would do it for the students. So, and probably because the reason I got into AIIMS, because of his this thing it was. And also in the medicine department, we had Dr. Bhavani Prasad and Dr. Mogopal sir were really instrumental in teaching us the basic skills of examination of a patient and history taking and everything else. So moving on from medical college to All India Institute. When I got into All India Institute, and I got 10th rank, and I was on top of the world, and I thought I had achieved everything in life, and I went there. And there I realized that reality actually struck me there, that I was the least qualified in the whole institute. Okay, so there were like stalwarts there in medicine, clinical medicine, and like we had people like Professor Jane Pandey, who is a well-known clinician all over the world, in fact. And we had Professor S.K. Sharma, J.P. Valli, all our teachers. Dr. Guleria, of course, was there at the time. He was an assistant professor. So all of them. So whatever medical skills I learned in terms of the clinical examination, everything, I was able to use it for my application, clinical application. And then I think the most important thing I learned in All India Institute was the meticulousness of seeing my patients, and the systematic way of seeing a patient and applying the clinical knowledge, what we know, and hard working. So we all learned to work hard, I think, in All India Institute. The grueling hours, like we used to work literally 16 to 20 hours a day in the first year at least. Definitely 16 to 20 hours a day we used to be in the hospital. And then there were a lot of seniors also whom we learned from a lot during this thing. So some of them are here in actually Hyderabad in various specialties, other specialties not critical care. Like Dr. Srikanth, they were all my 2-3 years my seniors in internal medicine. Like Dr. Srikanth Vimla, urologist, and Dr. Srinivas Murthy from Kakinada, he is a gastroenterologist right now. And then I had Dr. Rajkumar, who is continuing to be a physician. He was working in Nampally here, and then he was. So all of them were like our seniors, and we would be with them in the first year and third years. So we learned a lot of procedures and clinical knowledge from them. So apart from our consultants, we learned a lot from the seniors. So I always keep telling my students also that the best time you learn is the training period. So when the training period, whatever you learn during the training period, what you're going to practice for the rest of your life. Because nothing, you will not change after that. So whatever practices or the methods of seeing patients and taking care of them, you develop during your training period, that's what exactly you want to practice for the rest of your life. You may have a little fine tuning during your specialization, but the basic skills will remain, and that you have to learn only during your training. So you have to work hard during your training period. There are not many other students here for today for me to tell this message, but I think that's a message I would strongly give to all the students, that during your training period, concentrate only on your focus on your training program, and because that's the time you're going to learn the most, make the most mistakes and also learn the most, and you want to use it for the rest of your life is going to be with you. And then from there I moved on to PGI Chandigarh, where again very good set of teachers I had in my department. First, Professor Jindal was HOD, and like recently when this thing came up about the September 5th, this felicitation, Dr. Nagarjuna from Pulmonology department, in the junior in PGI, he put it up in our department group there. And the first person to respond to that was my Professor Jindal. So that's the level of his humility and the humbleness of those people who are so qualified, so educated, such great teachers, and still they were the first person to congratulate me on getting this felicitation. So, and we also had Dr. Ashutosh, Dr. Ritesh, Dr. Dheeraj, and Dr. Bhairav, or other consultants who were with me, who trained me and for pulmonary care medicine. And so what I would like to say is that as teachers, we have great responsibility towards our students. That I always believe in that, like they already told you, that if a student has failed, the teacher has not done their work up to the mark. So the teacher has also not done their work completely. We have great responsibility because the students are going to be the future generation, and they're going to practice the way you teach them to practice. Not only clinical medicine, but also other things like how you connect yourself with the patient's family, with the other colleagues and other departments. They're going to follow you. And mind you, the students will learn the wrong things first. That's very easy to learn. So all your negatives they will learn first, and they will learn and practice it also. But the positive things are more difficult to learn and to put into practice, so they will not learn. So we should be very careful how we connect ourselves in front of students, so because they will follow you blindly. So that's the thing. So we should also be careful because they are the future of the critical care, and then they will have if you train them well and you make them good students and good citizens, then they will have a positive impact on the patient outcome and the society also. So I think my journey of becoming a good teacher or a great teacher is just starting with this felicitation. I think I'll start with that, and then I hope that one day maybe I'll become a better teacher in life. So I think my journey just started of becoming a good teacher. I need to concentrate more on teaching. I'm not able to do that because of lack of time, but I enjoy both patient care and also teaching. Both are my passion, so I am not able to provide time for both adequately. And see how we can do this better in the future. I thank you all again for this.